What is core Intima, or what are CO2 treatments for the vaginal canal and for vaginal health all about? Well, essentially, they're restructuring the tissue just like they do in any other part of the body or on the face, making really brand new tissue, making the tissue healthier, thicker. How does it work for the vaginal canal? What it does when we relay new tissue or remodel the tissue, it can tighten the tissue, it can restore some of the firmness and laxity of the tissue. What it can also do is improve some of the tissue functioning, so it can increase some hydration in the tissue because the vaginal mucosa begins to function more normally. It also changes the pH of the tissue, so there's less itching. And also that can contribute to improved function as well, and improve. As an additional benefit, what we have discovered over time is that it helps quite a bit with patients who have complaints of stress urinary incontinence. What stress urinary incontinence, or SUI? It's basically leaking when you exercise, or you cough or jump or sneeze or laugh. It can happen after childbirth, it can happen after menopause. So by buttressing up and reforming the angle of the urethra, patients find that helps, particularly their mild to moderate symptoms, very well. Also, it can be used for treatment of lichen sclerosis. We just finished a study on the benefits of CO2 laser treatment in addition to patients that are on what's called the gold standard steroid treatment for lichen sclerosis, and CO2 through remodeling the tissue can make that tissue healthier and relieve some of the patient's symptoms of lichen. People wonder, well, does that really relate to me? Is it just cosmetic? And the answer is no. Those conditions are actually very common. Those conditions can be things like vaginal dryness that is related to the menopausal state, so very, very common in that situation. It can be stress urinary incontinence, which is something that happens often after childbirth due to some laxity in the canal, or also postmenopausal, so again, very common. There are less common symptoms or less common conditions that lead to symptoms of vaginal dryness and pain and ulceration and changes in anatomy, and those conditions are things like vulvar lichen sclerosis, and those are not as common, but certainly are more common than one might think. And so there are a variety of things. In general, the procedure is not particularly painful. It's important to numb. We do use topical numbing medication for the external portion of the procedure. Internally, it is not painful, and we don't numb because the internal vaginal canal really doesn't have a lot of nerve connections, and so the only pain that you feel or discomfort is from any kind of pressure from the probe that's used, and really this is the probe that delivers laser energy. We connect it to the CO2 laser, and it's kind of like an ultrasound wand that goes in, and then the laser applies the energy inside the canal. Most patients, unless they have very severe symptoms, do very well with the treatment, and with just the numbing, and usually they're texting or watching something on their phone during treatments 2 and 3, and because they're not at all nervous, and it's one of the reasons why one may wish to treat some of these conditions, and particularly conditions such as GSM, which is the genitourinary syndrome of menopause, is that research has found, studies have shown, and this is a study by a colleague, Dr. McQueen Alexiadis, published 2 years ago, and she found that if you do the treatments within the first 3 years of menopause, the long-term benefits or longer-term benefits are greatly improved. You get a higher degree of success and improvement in your symptoms than if you were to wait. Essentially, what's happening is that the tissue is really just being remodeled. You're having new collagen form. We've done studies that show histology that clearly show new collagen forming in those areas. We show new vaginal mucosa, new epithelium, and what that means is that epithelium functions better, so the pH is right, which helps with any kind of symptoms of itching. Dryness is improved. Oftentimes patients will say sensation is improved because what CO2 laser does is it helps your body create new vessels. So we call it neovascularization, which just means that we're making new blood vessels, which is a way to help provide nutrients and oxygen to the tissue that's there. So, so it's really a very straightforward process in terms of what's happening at the tissue level when you apply the energy and you create the heat-induced areas that will then subsequently make new collagen and make new elastin and make something that is less flexible, a little bit more flexible, contract some areas of tissue where you want to contract the tissue, and then just make the tissue function better.